Hi guys, and welcome back to my channel. So in today's video I'm going to be sharing with you my 20-week pregnancy update. I realise I haven't done one of these since I was about 12 weeks pregnant, and the reason for that is that after the first trimester my symptoms, a lot of my difficult symptoms start to go away and I start to feel a lot better, and that's been the case this time as well. But there is still quite a bit to update you on because I haven't spoken to you in ages. I'm going to talk about my scan that I just got and also my maternity and my midwife visit that I just had as well. So that's all to come in this video. If you don't know who I am, my name's Abigail and I make videos about pregnancy, and I've also got a toddler who's 2 and I make videos related to that as well. So if you haven't subscribed already, then do subscribe for more videos like this. If you're farther on in your pregnancy, I have pregnancy videos from my first son Samuel, and if you're not as far on in your pregnancy, then I have videos from this pregnancy as well from earlier on. So there's loads and loads of pregnancy videos on my channel if you're interested. And without further ado, let's get straight into my symptoms. So I've grown quite a big bump since last time I saw you guys. Since last time I showed you my bump, I'm now about 95 centimeters around the widest part of my stomach, and I feel like I've got a bump now. Like, it's quite a noticeable bump. And when I'm wearing just normal tops and stuff, you can see there's a bump there. And I actually really enjoy this. This is the part of pregnancy that I tend to like because you feel much more pregnant, and I personally like to feel pregnant. I think it's nice because I don't have horrible symptoms like some people have bad symptoms. After the first trimester, like I said, I tend to feel a lot better. So I have been feeling a lot better. My motivation and energy levels have skyrocketed since then. I've been feeling really great. I have had a few symptoms which I've been like, ugh, not enjoying, but for the most part I've been feeling amazing. And yeah, basically the weeks since 12 weeks, the weeks start to go really fast. I find after the first trimester, I like all the stress and the nausea and everything I get, I find that the weeks go really fast, and it's suddenly 20 weeks and I'm like halfway through my pregnancy. Can you believe that? If you guys are also halfway through your pregnancy, that's crazy, isn't it? It seems to have gone so fast, like this last little bit. The first bit drags and this bit goes so fast. Okay, my other symptoms I've got is peeing a lot. I feel like I pee literally constantly. I pee like every time I go upstairs, downstairs, in bed at night. I pee. I get into my bed to get down for the night and I pee like 5 times before I even go to sleep. And then I wake up at least 3 times in the night. Like, I feel like my bladder is tiny. And yeah, I just feel like my bladder is so small. So I pee loads. That's obviously a really common pregnancy symptom because of the pressure of the baby. The other thing I've got is discharge. Yay. Lots of discharge. I just don't enjoy it at all. I have to wear panty liners all the time now, and that's like the only solution really. But I have got that, and I am feeling some little movements. So some little flutters at my tummy. It's so exciting to feel like the little baby finally moving around in there. I didn't start feeling the baby move until about maybe last week. So well, I'm 21 weeks now. So like when I was about 20 weeks exactly, that's when I started to feel the little flutters and the little baby kicking. And that's just the best feeling, isn't it? It's the most exciting part of pregnancy, is feeling the little baby move. So cute. I love it so much. And like I said, my nausea is pretty much gone. I feel the odd bit of nausea here and there, but it's nothing like it was in the first trimester. And I've got a good level of energy, but I'm not sleeping well, like that well. Like, I'm sleeping okay, and some nights I sleep really well, but because I'm trying to make a conscious effort to sleep on my side, it takes me a while to get to sleep usually, and then when I do get to sleep, it's not like the best sleep. I have a lot of dreams and I wake up a lot to pee as well, so it's like sleep is like not the best, but it's not that bad, so I'm not going to complain about that. I'm going to talk about my scan now. So my 20-week scan, the exciting scan that everyone waits for. So I'll just go through like exactly what happened in my scan in case you're coming up to your scan and you want to know what it's like. At the moment, as I'm filming this, if you're watching it when it comes out, you'll know this, but if you don't, if you're watching it in the future, then this is the coronavirus pandemic time, so face masks have to be on. Some hospitals aren't allowing husbands or partners in. The hospital that I went to last week did let my husband come in with me, so that was great. What happened was basically I had to go into the waiting room by myself, tell them my name, and then when it was time to go into the actual room, I called my husband to come with me. So it was a bit annoying, but he got to come with me, so I didn't really mind. It wasn't busy at all this time. Like, the first scan I had was really busy. This scan was really quiet. And the scan in total took 45 minutes, which is longer than I had with my first son Samuel. And the reason for that was there was a trainee in as well. So there was a lady the sonographer doing the scan, and then there was also a trainee, like, I think explained what was happening to her. what was happening like in the scan to me. And yeah, so it was all explained, and it was like a bit longer because it was a trainee, and the trainee at the end actually had a little play around and like tried to, because she was obviously training, so she was like, she'd never really done that many scans, so she had like a practice scan on me, which I thought was fine because it meant my appointment was longer and I got to see my baby for longer, so I'm happy with that. I have really good experiences with my scans. I live in Scotland, so maybe England is slightly different, but I'm always taken on time for my appointments, almost exactly on time usually, especially for my scan appointments. They're quite like snappy about them, so I was taken on time and I didn't have any negative experiences about it. But I do know on Facebook groups I've been following that other people have slightly more negative experiences, but my experience was fine. So I went to the scan room, and then on the wall in my hospital anyway, they have a big TV on the back wall so that you can see what the midwife and what the sonographer is looking at on her screen. So she's got a screen here, and I'm like lying here, and then there's a screen there. So when she wants, you can switch that screen on at the back and you can see what she sees on her screen, which is different from when I had Samuel, because when I had Samuel I was at a different hospital, and at the time they only had the midwife's and the sonographer's screen there. They didn't have the one at the back, so I couldn't see what the sonographer was seeing, and so it wasn't like as nice an experience. This time it was lovely because me and Philip both got to see the baby, and we just chilled like looking at it, and it was so nice. So she did the anatomy scan, which is what the 20-week scan is for. So she looked through all the parts of the baby, the spine, the head, the heart, literally everything. It took quite a while, and I was quite happy with how detailed she went into it. She took her time and she did all the measurements, and she said everything about the baby looks perfect. So I'm really happy about that. That's like the big kind of relief of, because that's the kind of, the 20-week scan is when you find out if there's anything majorly wrong at that time with your baby. And so to find out the baby was fine was such a relief. So I was very happy about that. Like I said, there was a trainee there that had to go afterwards, and like I said, I was quite happy with that because I got to see the baby for longer, and also we got extra pictures. So we got given extra scan pictures at the end because we got the training to do it as well, and they thought that was kind of an inconvenience. So I was doubly happy. I got to see my baby for longer and I got extra scan pictures. So that was amazing. So I'll show you my scan pictures. They're back here because everyone wants to see a scan picture, don't they? I just think they're so cute. Where are my scan pictures? So here is the ones that I got from the sonographer, the qualified sonographer. Let's see. Focus. There's a little head. So cute. This is little baby Purum. And then these are the extra pictures I got taken, which you can see are not quite as good. This was taken by the trainee. We thought this was funny because this is the head, and then this little hand is up here like this. Like, oh, stop poking around and annoying me. So that was really cute. So those are the scan pictures that I got. And yes, we also did find out the gender. I'm going to tell you in my next video about that because I like to drag things out, you know. So I'll talk about the gender in the next video because this video is going to be quite long. But we did find out the gender at that time as well. The only big thing to really come out of that was that she said my placenta was in a slightly weird position. I don't know, the way she described it was it's slightly anterior and slightly posterior. Basically, I think it's lying a bit low, and so that can be a risk when it comes to give birth if the placenta is kind of blocking the exit to the baby. This is what I found out what I looked up, so this is what I think's happened. So I need to go for another scan at 32 weeks to check the position of the placenta again. And it basically puts you at slightly higher risk of bleeding during pregnancy, so obviously just be extra vigilant. I have to be extra vigilant to look out for bleeding and to go straight in, obviously, if I see anything like that. I'm not massively concerned about it because she didn't seem massively concerned. And on the Facebook groups I'm on, it seems quite common to be told this, and then for the placenta to like sort itself out nearer to the time, because I'm only halfway through pregnancy. So near the time, I feel like it's going to sort itself out, hopefully. I'll find out at 32 weeks and I'll update you. But I'm not overly concerned about that at the moment. But obviously if it's still like that at 32 weeks, it's going to be a bit more of a cause for concern. Finally, I'm going to talk about my midwife appointment that I had. It's quite funny actually because I had my 12-week scan and then I didn't have an appointment for like ages, and then at 20 weeks I had both another scan and a midwife appointment. So it's like buses, you wait around for one for ages and then two come along at once. So I had my scan, which I just told you about, and then my midwife appointment was like the start of this week. And so I just went in there yesterday, and It was quite a quick appointment. This one actually I didn't get taken on time to. I was about 20 minutes late for this appointment. I wasn't late, like the midwife was a bit late to take me in, but it was fine. And she didn't do a lot. She checked the baby's heartbeat and she found it really fast and it was really strong, so that's great. She took a urine sample, which she has to send off for testing, I think. And then, what else? She gave me my MAP B1 form if I want to like apply for like paternity leave for my husband. I'm not working at the moment, but he'll apply for paternity and we might need the form for that. And then she gave me like relevant leaflets of information, basically. That's pretty much what she did. She asked me if I had any concerns, and I didn't really. That was pretty much it. And she just talked about the placenta thing again. It was like about 10-15 minute appointment. It was really fast. I do have to go back at 24 weeks for another appointment. I don't know if that's, I think that's because of the placenta issue, because this is my second baby, and in my notes, so you know these notes that you get if you're in the UK, you get these notes and it's got information in it, and in mine it tells me, like in the bit like here, if you've got one of these, it like ticks when you should expect to have appointments here, and on mine it says 20 weeks for the scan, and then between 20 and 24 weeks for a midwife appointment, and then I should have one till 28 weeks. So I think I'm getting an extra midwife appointment because of the placenta thing as well, which is fine. I'm quite happy to get extra appointments. I feel like with coronavirus and also having a second baby, I've not seen a midwife like hardly at all this time compared to the first time. So I'm quite happy to have extra appointments, just to make sure everything's extra fine and to hear the baby's heartbeat more. So I'm very happy about that. So I think that's all the information I've got to talk to you about today. If you're pregnant, leave me a comment down below. Let me know how far along you are and how you've been getting on. And I'll see you very soon in my next one. Bye guys.